Assalamualaikum warahmatullahi wabarakatuh. My name is Aisyah Fadhilah binti Khair-ul-Nahar. I'm in matric number S23 DBT 19F1062.
Hello, my name is Jihivaanayagan A Murgis with matrix number 23 DBT 19F1069. So today I'm going to present an oral presentation on title Depression, Anxiety and Stress among undergraduate students. So even before I begin, I want to let you all know the reason behind my topic. Nowadays in our country, Malaysia, cases of students committing suicides are increasing day by day due to the unbearable stresses they are going throughout their life. Yeah, so now let's continue on this. So firstly, the table. In the table we can see emotional instability, which are divided into three types: depression, anxiety and stress. Each of these are measured in 5 different levels, starting from normal, mild, moderate, severe and extremely severe. So let's look at the depression first. For the depression, the frequency for normal is 50, then goes down 13, 18, 8 and lastly 2. So each of these, if we calculate in percentage, for the normal it has 54.9%, mild 14.3%, moderate 19.8, severe 8.8% and extremely severe 2.2%. Next, anxiety. The frequency starts from 21, 23, 27, 10 and also another 10, with the percentage for normal 23.1%, mild 25.3%, moderate 29.7%, while as for the severe and extremely severe, both has 11% respectively. Next and lastly, the stress. The frequency starts from normal with 60, then goes down to 18, 10, 3 and lastly 0. For the percentage, it has 65.9%, 19.8%, 11%, 3.3% and finally 0%. Next, let's look at the graph. So as for the yellow color, it indicates depression, blue for anxiety and red for stress. So at the side of the right, you can see stress. Stress can be divided into 3 types, which are eustress, acute stress and chronic stress. As for the anxiety, it is a reaction of human body to threat, danger or stress. And finally, depression and anxiety are common, serious, debilitating mental health problems. So, from the graph on the slide previously shown, it was taken from the private educational institution in Malaysia about the level of depression, anxiety and stress among 91 students at there. We can see that the overall stress level is the highest among emotional instability of normal, with a frequency of 60 out of 91 students. That is covering a total of 65.9%, and the lowest emotional instability also from stress with 0 out of 91% students, which is equivalent to 0% having extremely severe level of stress. Well, that is a good thing. So this shows that there are not too many people, or maybe not at all, having extreme severe stress leading to suicide. There are a total of 5 different levels of emotional instability, starting from normal, mild, moderate, severe, extremely severe, and Three different types of emotional instability have been studied, which are depression, anxiety, and stress.
So for the graph of percentage, bar chart of percentage shows the respondents level depression, anxiety, and stress. Majority respondents 54.9% having normal level of depression, followed by moderate 19.8%, mild 14.3%, severe 8.8%, and extremely severe 2.2%. Next, anxiety level. Most of respondents are moderate 29.7%. Next is mild 25.3%, normal 23.1%, and followed by severe and extremely severe 11%. Lastly is the stress level. Majority of the respondents having normal stress level, which is 65.9%, mild 19.8%, moderate 11%, and severe 3.3%. In conclusions, this finding is alarming in terms of increased risk for psychiatric morbidity because it indicates the amount of burden students have to bear in the current scenario. It is necessary for students to be in their better psychological health so as to achieve success and for a brighter future. Early interventions are necessary to improve the quality of life and reduce the level of stress, depression, and anxiety among undergraduate students. Multiple factors such as feeling of incompetence, lack of motivation to learn, and difficulty of classwork might act as source of the stressor that may precipitate depression, anxiety, and stress. Therefore, initiations of stress management programs such as expanding counseling activities, providing adequate facilities, and resources should be highly prioritized by authorities. Sharing sessions on study techniques and coping skills workshops should be planned for the target groups. Lecturers may help the students to overcome their difficulties in their academic life by enhancing the mentor-mentee programs. Discussions in detail with the students who are having problems will help them to release the tensions applied on them so as to motivate them to give a better effort in their study. Overburden on the student may cause emotional disturbance and exhaust them physically and mentally. That's all from us. Thank you.
That's all from me. Thank you.